Hello everyone and welcome to this special edition of Team TV. Listen, this is a show that's going to change your life or change the lives of your loved ones. I'm Pamela Anchang. Are you sick and tired of job insecurity or being laid off? Well, I have great news for you today. The healthcare industry has proven to be one of the most reliable professions in America. And so, I am so thrilled to introduce to you a special guest who is also an owner of a nursing institute. She's going to be sharing with us all the insights you need to have to build a successful career in nursing. This is the first time we are having such an expert on our show, and I couldn't be more proud of her accomplishments and what she has to offer. But before I bring her on, I want you to do me the honors. Subscribe to our channel if you haven't done so yet by clicking on the subscribe button here below. Also liking us so that YouTube will share our videos, and don't forget to ring the notification bell so that you will be notified when our content is shared. And of course, don't forget to follow me, Pamela, at Pam and Chang on Twitter and Instagram, and like us on Facebook at the Immigrant magazine. So without further ado, here's what I have to say about my guest. She is Claudia Mbah, the visionary leader behind Comfort Paradise Home Care Agency and Training Institute. With years of experience in the industry and a heart for service, Claudia has created a one-of-a-kind training program that equips students with the skills and knowledge needed to succeed in healthcare. So get ready to hear her story, learn about Comfort Paradise's unique approach to training, and discover how you too can pursue your healthcare dreams with confidence. Whether you're considering a career in healthcare or looking to advance your skills, this interview is a must-watch. So stop whatever you're doing and join me, and let's welcome Claudia Mbah. Oh my gosh, Claudia, it's so good to have you on our show today. How are you?
I'm doing fabulous. How are you?
Oh, I'm doing really great, and I really don't even know how to express the joy and the pride that I feel for you for what you've been able to accomplish, young, dynamic immigrant now. Before we talk about all the amazing things in the healthcare industry, and especially nursing, I really want to know, first of all, your journey. I'm always intrigued by the stories of immigrants that come here and just make a difference. And looking at you, one would even think you're over 18, and yet this institution has birthed quite a few graduates. So tell us first about your journey to the United States. What brought you here in the first place?
Thank you so much, Pamela, for being here. You and your team have been amazing. A little bit about my journey, coming from Africa, Cameroon, to be precise. I moved to the United States to provide my sister a better life. I grew up with my family, and Mom, she traveled. So my oldest sister, she literally raised me, and living with her for all those years and just seeing how the connection she had with her husband, and just being the superwoman that made everybody happy and still walk with a smile on her face, going through a lot, I felt like I should be able to give her a better life. She deserved more. And it's sad to say that she didn't even live to see her dreams come true. And I remember when she had to, she was taking us to the airport, the excitement that she had that we were coming to the States for a better life. She was just so happy, and bless her heart, Bridget, she left us so soon, and I couldn't give her what, like a good life that she deserves. And
well, she's watching over you. It's so amazing. When you say that you traveled, you came to the United States because you want to provide for your sister, is that the sister you're talking about?
Yes.
Well, that's interesting. What's so funny is that every time I talk to someone, I have a connection, because when I left Cameroon, and I'm from Cameroon just like you, I really left because I was sick and tired of lack of opportunity, and I'm the oldest of 6 children, and I just knew that I had to leave to make a better life for my siblings.
That's a similar situation with us because we're 6. She's the oldest. She was the mother of us all, and
Well, you know what? Every immigrant story, right? We come here and then you know how it is, like, oh my gosh, what am I going to do? There's a myriad of things because growing up back home, there are not so many opportunities. Now you come here and everybody tells you the healthcare, the healthcare, the healthcare. I remember when I came here, I wish I'd listened though, but I have no regrets because I love what I'm doing now. But I wish I'd listened because someone told me, you know, go and be a nurse. But back home, you know, we had this idea of nursing. It was not really something that was pushed. It's like you had to go to school, get the 4-year degree, and become a this and become a that. I had other dreams, but America gives you opportunities in nursing field, and today we see that is the most reliable or dependable because you follow all these professions, and next thing you know, you're out of a job.
that's true.
So I want to know from you what, in the first place, made you want to become a nurse.
That's a great question. So when I was back home, Mom will send pictures of us in her scrubs because she worked as a nurse, and she looked fabulous in her scrubs. So I looked at that moment. At that moment, I wanted to be a manager in the World Bank. I was, you know, good in accounting, management, and all of that. But seeing my mom's pictures made me kind of like nursing, just seeing how she looked in it. And also, she was, you know, she told me to become a nurse, so, and I did it.
Well, you're a good listener then.
Yes. She said, Claudia, I know you love to travel if you become a nurse, and you can travel and still be a nurse. And that's exactly what I did. I've been a traveling nurse for almost about a decade, and I have loved it. I've served patients in different areas, and it's been beautiful.
You know, I've seen a lot of nurses. They don't look as relaxed as you do. So that's why we have you here today to tell us what it takes to be a successful, to pursue a happy and successful career in nursing. So tell us a little bit about, Comfort Paradise, because you actually call it Paradise. By the way, what inspired you to call it Comfort Paradise, and what is it about?
So Comfort Paradise came into light with me working as a hospice nurse with Kaiser. And there was this day I had this patient that was about to pass on with liver cancer and had no one except for an autistic son as a caregiver. So, and as you know, everything is, with the system, everything takes time. So having to apply for her to get a caregiver could take a couple of weeks, but she had just a couple of days. So I reached out to the social worker, and she said, Claudia, it's going to take a couple of weeks for us to find, because the paperwork has to go through, and then she gets approved to get a caregiver. She doesn't have no money. The doctor was like, Claudia, this is a tough situation. So long story short, we had to send her back to the hospital, and she passed away against her wish of being surrounded with loved ones with the care in her home. So for me, that was an aha moment. I went home, and that was how Comfort Paradise Home Care came to light, to be able to provide people with a caregiver. So especially with the hospice population, so they don't have to pass on against your wish, not surrounded with loved ones. And when I went into the facility, when I went into the community and to inquire on who needs home care, I went to skilled nursing facilities, nursing homes, and hospitals, and they're like, Claudia, what we really need is CNAs. So that's how, from Comfort Paradise Home Care, Comfort Paradise Training Institute came to light to be able to provide CNAs that can provide care in both homes and in facilities and hospitals as well. And sometimes too, while home care was running, we will have patients that will say, your caregiver doesn't know how to empty a Foley catheter. They don't know how to operate a wheelchair. So I felt like they really need to build on their skills so they can provide the patients with the care they need to thrive in their homes.
That is fascinating because you're always so cheerful. And I can imagine, the story about the patient that was in hospice that was about to pass on, and you found this compassion, and that's what we think of what a nurse should be. So what kinds of programs are you training your students here? What kinds of students are you graduating out of this program? What can they learn?
So far, as of right now, we provide CNAs. They're certified nursing assistant. That's the program. And we train them with basic skills, bedside, how to bathe a patient properly, a patient that needs a bed bath, a patient that needs a shower and is bedridden, how to use a Hoyer lift to get them in the shower, how to feed them even though they're going to be at risk for choking, like aspiration, how to empty their Foley bags even though they cannot fully empty their bladders on their own. So when we have people that are skilled this way, it provides the nurse the opportunity to focus on medication management, on the bigger things. So having a CNA is very crucial to every healthcare nursing home, even in the hospitals. Because think about a nurse having to bathe all her patients, feed them and give them medication, and still make sure they get physical therapy. That will be a lot. So the CNAs, they play a super fantastic role. They're not recognized for so much work they do. They spend so much time with the patient. They connect deeply. They know the patient's inside out. Your skin from where the bed sore starts to develop.
Right.
They can tell if Ms. John Doe is having a bad day. They can connect really, really deep. Even with the families, when they come to visit, it's always the CNA or the caregiver at the bedside, making sure things are good. Even when the patient passes, they're there to provide that bereavement support. They're there.
Wow.
They make sure they clean the patient, that postpartum care, wash them up, dress them up, give them that dignity that they need even at their last days. So CNAs, you rock.
Yes, they certainly rock. And you know
They
what?
do.
When you're talking, I was listening, and I'm not in the nursing field, so I don't know the different categories of nursing. And I'm sure our listeners, audience is wondering what's a CNA. Now you've just listed the responsibilities, and you're distinguishing with the CNA and the nursing.
Right.
So what's the difference? Who's a CNA? What is that? Is it certified? Can you just tell us what it is?
So in the healthcare industry, you can start as a caregiver or a home health aide. Then you can work your way to a CNA, a certified nursing assistant. A home health aide can only provide care in the home setting. A CNA, which is the next level, you can provide that same level of care in the home, in a skilled nursing facility, and in a hospital. Then you have a medical assistant that can provide care in a doctor's office. And then you have an LVN. An LVN can provide more skilled care, like they can insert a Foley catheter, they can do wound care, medication management, and things like that. And then you have the registered nurse. The registered nurse supervises the LVN, the CNAs, and the home health aides. They customize the plan of care like a roadmap on what they're supposed to be doing that stays within their scope of practice, so that way the patient's life is not in jeopardy. And then you have the nurse practitioner and the physician assistant. So those also, and then you have who can work in the doctor's office. Sometimes you go in and you see a nurse practitioner or a physician assistant, and then of course you have the doctor. So that's like the level.
Oh, that's really interesting. I'm so glad you broke it down. So in your particular case, what are your own, by the way, all the courses that you provide here are accredited, right?
Oh yes, we are accredited by the California Department of Public Health.
Mm-hmm. That's wonderful. So for you, for example, you are a nurse practitioner, you're RN as well. So tell us a little bit about your credentials.
So I'm a home health aide because that's where I started. I started as a home health aide, and then I became a registered nurse with my BSN, and then I later on got my master's and specialized in family practice. And then I didn't become a doctor, and then I started home care in the school.
So you went through all of it. I like how you still own your home health aide, right?
Yes, I'm still a home health aide.
So there are times when you act like a home health aide, and there are times when you just the big nurse, right?
When I still run home care, there's times I still go and cover shifts. Mm-hmm. I still go and get my, roll my sleeves, give that shower, go grab the groceries,
Yeah. Well, you have all the credentials for it, so that's what really makes that's very reassuring. So, what are the admission? It's so funny. I'm just thinking, like, you did all this and you do all this, and you decide to have a school and institute. You know, a lot of immigrants when they come here, I don't care, the engineers wherever they are, they came from, and they just want to be able to take care of their families. And sometimes they're waiting to pass a board exam for maybe engineering or become a medical doctor. Some of them are doctors and everything. I mean, immigrants come here already educated. Most immigrants at least have a bachelor's degree.
Right.
But when you come here, it's a new environment, they have to survive.
Right.
And so, you know, depending on who receives you, they'll give you guidance. So I'm really hoping that we can give some insight into the healthcare, because there's a lot of this stability. What I notice is the stability in it. So I just want you to tell us a little bit about your admission requirements, what a prospective student needs to have in terms of prerequisites, for example, to do the CNA, because what are the requirements for that?
That's a great question. So you do not need to have a GED to become a CNA. However, you need to have your Social Security or your IT number. You need to be legal in the United States, of course. You need to they will do a live scan, fingerprint, make sure you have a clear background, because we're going to be dealing with elderly people that are very vulnerable, and we do have an entrance exam. They'll have to pass that little entrance exam. It's very easy. It's just basic English. I want to see how you can read, some basic math. They need to have a TB clearance. We don't want to expose them to this vulnerable population if they've had some level of exposure with TB. Some people, because when you're an immigrant, your TB will come out positive. So that's when they have you go do a chest x-ray. So the TB clearance is good for 2 years. The chest x-ray is good for 5 years. So you need your live scan or fingerprint, TB clearance, and then you do a head-to-toe physical examination by your doctor. Can you lift a patient? Do you have any health issues? Because, you know, those are the basic stuff that you need.
So that's interesting. You know, we always test positive for TB. That shocked me, even. And then, but why is that? I know there's an explanation. Are we exposed?
Yeah, because at some level in your life, you've been exposed to TB. So it's always going to come out positive.
Oh, wow. So how do the students, because, you know, when they come here, they're trying to get into the CNA or home health, because they want to be able to at least pay their bills and take care of their basic necessities. Because trust me, every immigrant has big dreams, just like you. You came home health and now look at you're this big boss. So how do they pay for this, you know, to go to take the courses?
So tuition is two ways. You can choose to pay out of pocket, which is, our tuition is $2,500, but we do have a discount going now. So
Exactly.
And we make sure we can set up like installmental payments, and the tuition includes like your books, your uniform, your BLS, which is a CPR card, just to get you up and running. We do have scholarships. If you want to do home health or you want to be a caregiver, I could sponsor you. In return, you have to commit a 12-month commitment to do home care. We do have facilities, skilled nursing facilities, that are willing to sponsor and you have to commit to work with them for 12 months. Shout out to Beechwood, post-acute, Antoine and Rose. They have sponsored over 30 CNAs.
Who are those?
They're this big, it's almost like I don't know if it's like a 300 plus bed facility.
Oh, okay, it's a facility.
Yes,
okay.
So they have sponsored most of our students.
That's wonderful.
And they're still working there.
Well, shout out to them. Thank you for helping.
Yeah, Beechwood has been their rock.
So, Miss Claudia, you know, this field is very competitive, even though, you know, people need nurses. How does Comfort Paradise stand out?
Oh, wow, that's a great question.
Loaded, huh?
So how do we stand out? So we've had CNA students that have come to us and they've been to multiple CNA schools and have not passed their state exam. Our curriculum is, the other schools, I would say like they're 2 grades below, ours is 2 grades above. So once you go through our program and you pass the state exam, most of our students, they feel like, I can be a nurse, I can be an LPN, I can be an RN. Some that have started LPN and did not finish, and they came back for CNA, they're like, oh my gosh, that's what happened in LPN school. What are you just taught in here? So our curriculum is like it's two levels up from the standard CNA.
That's amazing. So what's your vision for your students? Like, what do you expect from them? What are the expectations of them?
Oh my God. I want every CNA that comes through this door to not only settle, to push themselves. You did this 5-week commitment and look at you, you're a CNA. Push yourself for a 14-month program as an LVN. Push yourself for 3 years to become a registered nurse. Just push yourself. And I do offer like a nurse mentorship program. Okay. When they graduate, they can always reach out to me for more guidance on how to navigate the healthcare industry.
That's exactly what's going to be my next question. Like, okay, now you have the certificate. How does Comfort Paradise help them get into the workforce? So beyond the mentorship, what else can they expect from you?
So I've been in the community building relationship with nursing homes in different zip codes. 2 days ago, I was in Upland, Chino. I had to commute all the way there. And I just asked them, do you have the needs for CNAs? Just so they can have that job placement close to their zip codes. Okay. I want to have you talk to, there's the DSD, the Director of Staff Development, who makes sure they get hired. So I try to connect with her and say, hey, can I give your number to my students so they can apply? And they always need CNAs, so it's always a yes. So that job placement close to home is always like my ideal goal, just to get them up and running.
Now, you know, most, because we're talking really to a very immigrant audience. And America is a country of immigrants. Even those that were born here, some of them still have challenges. There's the accent, there's the language. Like you said, you do a test for English and whatnot. What's the methodology? What kind of methodology do you use that makes students relax and be successful? And then a lot of the time also, some of them don't have the resources in terms of maybe like computers or, you know, the necessary things that they need to be successful. What kind of methodology do you use that will make them relax?
Oh, that's a great question too. So we don't only teach you as a CNA, we teach you soft skills on how to navigate a computer. Every week they get tested on the computer, timed, on camera.
Really?
Yes. By week 5,
now, I have to say this. Let me tell you something. People don't know this. When I just came to this country, okay, that's almost 30 years ago, but I'll tell you what. You know, back then, computers were not as popular as they are now. And this is not just for me, because I know even Americans really, some people did not know how to type. I did not. So there's no joke. I had actually a graduate degree, like post-grad, and I did not know how to type on a computer.
Right.
That is true. So, so when you say you're testing them.
Yeah, we provide laptops. We do have laptops that they use, because most of them, they try to chime in on Zoom on their phone. So we do have laptops here. Towards the end of the program, we help them with their resumes. You know, if you need help with that, we can always, you know, we'll get your resumes up and running. We have people that have been here like almost 20 years and they don't have a resume.
A resume.
And they've been working for those years, nothing to show for it.
The look on your face is like, really? You have a resume?
Right. So we get you, you know, that resume and. Yeah.
Well, that's wonderful, because that's a big deal. Because the resume is what is going to empower you to be able to go out there and look for jobs. Because that's the first thing any employer is going to ask for. Can I see your resume?
Exactly.
You know, so that really brings me now to another question, which is really important. How do you make sure that students are comfortable knowing that you are staying up to date with the industry standards? I don't know what it is for nursing, but I'm sure that there are processes, because this country is always evaluating, so that, you know, if someone graduates, they are sure that whatever they've studied is what is required of them, no matter where they go.
Right. So I am constantly on the CDPH website, the California Department of Public Health, and a few days ago, I had to go live and let everyone know, February 28th, because when we had the pandemic for the past 2 years, you could work with an expired CNA license. So they did that for 2 years to, you know, because of the shortage staff. February 28th was the deadline, so I had to let everyone know, CDPH has put it on there that you need to get your license. So our March session, the classes are filling up because everybody is like trying to get it in just to keep up with CDPH. So the CDPH website is where I eat, breathe. I get email notifications on any updates, which is similar to the home care, where the Department of Health Services, I get those notifications as well.
That's wonderful. That's really, really reassuring to know. So do you have any partnerships in the area? So for those who live in the area with maybe hospitals and, do you have any partnerships around you?
Oh yeah, shout out to Rio and Francis.
Who's Rio?
Rio and Francis with Alhambra Hospital Medical Center. They have like 7 to 8 hospitals in this area. So once the students graduate, I just say, call Rio, and Rio just absorbs them, puts them on the registry with Spectrum, and then they get to serve this population. Those hospitals, you can work as a sitter. You can work as a CNA. You can do so many things in a hospital with that CNA license.
Wow. I don't know if in the healthcare profession internships are valuable or exist, but I know, so funny I said this, immigrants, we do so many things. I studied computer engineering at some point, but in order to get into the workforce, I had to do an internship. So I did an internship at a hospital, like in the IT department. So I was wondering, in nursing, is there such a thing like internships? And if so, do you have relationships with hospitals that students can go and do internships for?
Oh yeah. So before we got approved as a CNA school, we had to tell the state, because they have to complete 160 hours, curriculum hours. 60 of those hours is supposed to be on Zoom.
Oh, so those are the internships then?
And 100 hours in the facility for those internships. So they're in the facilities doing all this hands-on from what they learned from Zoom. So they have to do that within that time period.
So you have those relationships because they'll need those hours.
Yes. Shout out to Beechwood again. Beechwood Post-Acute. They all go there.
Beechwood?
Yes, they go there.
Thank you, Beechwood, for all your assistance. We need to get this, because these immigrants, when they come here, trust me, they have families back home that are waiting. They're like, you're in America, the money is falling from trees, so send us money. So these folks need to get their jobs ASAP. You know what I'm talking about, right?
Absorb them and
Listen,
train them and
people back home, they're like, oh, such and such happened, I need money. I'm like, I don't even have a place to stay.
Right. Right. That's the reality.
Okay, so I know I asked the question before, but I was just curious. It just occurred to me that students with different disabilities, do you have room for people that may have some kind of disability? And what kinds of disabilities do you see, and how do you overcome those?
That's an interesting question, because a student can say they have a disability, but they read okay. Right. They can take care of a patient. So the only disability that I will not advise someone to do is if you cannot lift a patient. Okay. Because most of these facilities, you get put in different floors. There's floors where the patients, they're ambulatory, they can walk. Some is totally dependent. You have to lift them to change their diapers. So with a disability where you cannot lift a certain amount of weight, in Alhambra Hospital, before they hire you, you have to do a plank. Oh. You have to, Most of the students were not, you have to plank, you have to lift some weight so they can see how.
That you're strong.
They can see, because you can't be a liability, you can't injure yourself coming with a disability. So you just need to ask yourself, can you lift a certain amount of pounds?
So that was a good question I asked then, because someone's sitting in the house slouching there, they better get on the floor and do some planks.
Yeah. Very important. So I told myself, start planking if you're going to go over there.
Exactly. So what makes a good, what are the qualities of a good nurse? Listen, if you walked into I can see that you walk into a patient's room, Miss Claudia, they are healed, okay? Amen. Because you have the smile, you have the spirit of someone that cares. So when you are training your nurses, what are you looking for? What are the qualities of a good nurse? Even though it's CNA, like you said, they spend most of the time, more than probably the RN, more than the LVN. They're going to spend more time with the patient than the others, right? Right. So what are you looking for?
So it's It's a laundry list of things.
What can you smiling though?
Smiling is a plus, because these patients, they have a lot going on. You don't expect someone with an amputated leg to be in a good mood all the time. So you have to be that light. They're going to be in green, so they will be that light in the room. You have to be very compassionate about what you do, because people can feel that.
Right.
They can feel it. Work ethic, you got to show up. You can't say yes to a shift and not show up. That's because if you don't show up, you have people depending on you. And then your coworkers get to take your part of the work and work times 2 just because you chose not to show up. So for me, showing up and doing the work is like ideal. And I tell all my students when we graduate that you always want to serve first, the money will come later. Be of service, be of great service. The next thing, provide care like you have a camera watching you all the time. And the last thing, the last of the last, let's say you go home and you hear the patient passed away. What is that last impact that you left in that patient's house? Did you deliberately leave them in a wet diaper and they passed soaked in urine and their feces? Or did you clean them up and they had an amazing, peaceful pass on? So those are the qualities.
Well, that last one is the most important. Really, that one is good because we forget that we also will pass on. No one is here to stay.
Exactly.
No one is here to stay. So what has been your success rate?
For the school?
Mm-hmm.
We're at 98, 99%. Thankfully.
That is just amazing. I really don't know. So what kind of person should not become a nurse? Because I know it's about the money, and you just said serve and the money will come. Who should not become a nurse?
If you don't have the heart for people, that compassion, you're not in the right place. You need to be able to work under pressure. You need to be a team player, because sometimes you will have to report to the nurse, you will have to report to your coworkers, because you have to exchange shifts.
Yeah.
So a team player would be like, oh, I don't want the person coming after me to have to do too much. I have to make sure the patient is good. Mm-hmm. But if you just focus on yourself and you're not a team player. So if you're not a team player, healthcare is not for you.
It's not for you. And let's just say, and I want to ask you to say something about the future of Comfort Paradise. I know you started, your vision was the CNA, filling a void. Okay, what's the dream, ultimate goal for you? I know you don't want to stop, so can someone come and to Comfort Paradise, do CNA or home health, and then grow within here?
Absolutely. That's an amazing vision that I dream in. It's crazy. My mom, shout out to you, Mom. She was with me for like 3 weeks, and she said, you kept dreaming curriculum. Curriculum. Because the vision is to build on different programs.
Okay.
We want a situation where a CNA can work in a facility in a home. A phlebotomy can help the labs, the shortage. So the ultimate goal is to bridge that gap of shortage in the healthcare industry. The medical assistant can help, in the doctor's office. A licensed vocational nurse can help the nurses, the RNs, in facilities and hospitals as well. Why not RN? Because we're really short in the healthcare industry.
Yeah,
We're
and
really
you are
short.
determined to fill that void, right?
We're definitely working on it. I think the next time we'll
dynamic Claudia, the dynamic Claudia Mbah. She's still going places.
Definitely. The
Yes.
next time we meet, everything will be set up, for sure.
That's so wonderful. I would really love to speak to I want you to talk about some of your success stories. Do you have any that you want to share?
Oh my God, there are so many.
Will I be talking to a couple? Can I talk to a couple?
Oh, we have 2 of my students here. You're
Oh,
going to
okay.
be talking
Absolutely.
to them today.
All right.
You're going to hear from
so
them.
before I talk to them, just really quickly tell us, how does a prospective student enroll?
Oh, that's great. So you can give us a call. Our phone number is 323-844-0707. you can give us a call, or you can go on Google, just type in Comfort Paradise TI. You might get confused. There's like home care and T, so just make sure you're clicking on the school. On there, we have an online application process. We're on Instagram. You can, if you're an Instagram fan, you can go apply on Instagram, TikTok as well.
Okay.
So online application, and then you get a call from us to have you come in and take your entrance exam.
So what's your message for all those people that come here and they have all these degrees, some of them are PhDs, but they have to start from the CNA level? What's your message of encouragement or inspiration? What do you have to say to them about what it takes to succeed and the journey and what CNA can do for them?
Oh, that's a great question. I feel like you will see the CNA as a stepping stone. And I'm a true believer of the way you show up for one thing will tell how you show up for everything. So start at the CNA level. Test yourself on your work ethic. Test yourself on how compassionate you are. Test yourself to see how far you can go. Test yourself to see how far you can stretch, how far you can endure. If you know, the sky will just only be the beginning. And I'm always here to navigate, to help the best way I can. Usually when you come in, I want to know, like, where do you see yourself?
Exactly.
3 years from now, like, tell me about, I like to connect one-on-one so that way I can better understand you.
Do you think CNA is the kind of profession that someone can actually do well in and be able to take care of themselves and their families, or do you want them to always necessarily move to the next level? Because some people may not want to go any further. Is that a career that someone can actually build a life upon?
Oh, absolutely. If the healthcare industry is for you, because we have people they cannot stand touching a diaper.
Right.
That's not for them. If the nursing industry is for you, I always tell yourself, you don't want to wake up tomorrow and wish you did something. Okay. Just give it a try. It might not be as bad as you think.
All right, my dear. Thank you so much. I want to go meet the students.
All right. Thank you so much, Pamela.
Oh, you're welcome. We still have a lot to talk about.
Definitely.
All right? Thank you. Okay.
Thank you.
Wow, what an amazing conversation this has been with Claudia. I would not have imagined that all my years of hard work, exercising would pay off. Listen, I might just change my career. Why didn't someone tell me I can do so many planks? Now, if you enjoyed this program, I want to hear what captured or captivated you the most. What did you think about nursing before, and what do you think about it now? Because I learned so much. Compassion, that smile. Just think about if something were to happen to you, what kind of nurse would you want to attend to you? That is what Comfort Paradise is offering. So if you're considering a profession, a career choice, or maybe a switch, or if you, after this show, realize that it's not for me, please don't be a nurse, because being a nurse requires nurturing. And Claudia is an example. And if you think that this is for you, I suggest you pick up that phone and call Claudia, or go to their website and put in that application, because this could change your life. And don't forget to share this information with your friends and family, because as an immigrant, when I came here, someone discouraged me. I would have probably been a nurse practitioner by now. But the more I think about it, like she said, I don't think it's for me, because I'm a little sensitive. But I know I have compassion, and I know you also have compassion. So if this is for you, or if you know someone who could benefit from a career in nursing and wants to start from the bottom up, go and wet your feet and see if this is for you, and just go for it.